another question important that I mean, recently went through one article that says that MCI recently has put on a notice or a new rule that the doctors, specifically the medical practitioners, can't make themselves available and make themselves visible over social sites, just like justdial.com and Practo and everything. So that is somehow going against the compliance. So is it the same with dentist? Is DCI taking any such step? Because we are talking about digital and platforms. So that is why.
See, I think one of the challenges that the medical fraternity suffers from is knowing the difference between doing marketing and doing advertising. And this has been brought up many times. Even my previous post, one of my colleagues from the industry commented that the medical fraternity doesn't understand the difference between that. Any medical or dental council will have an issue with advertising, but none of them can have an issue with marketing. And marketing is more about communicating the value proposition that is being sought by our users, right? So while it is important to be present digitally, it is also important to come across as a trusted advisor for dental services, right? In this case, not that come to my clinic and I'm open 24/7. That kind of advertising doesn't really help, and it's against the ethics and rules of various medical communities and councils. But telling people, making them aware of their condition, making them aware of that help is available, making them aware that what are their options, I think that forms a very important part of marketing. And that's what dentists should focus on. Focus more on the problems of your area and how you're going to solve them, rather than throwing out information about your clinic. The sale, the business will come. All you have to do is win the trust of all these people from your community. Hope that helps,
Right.
Paritosh.
Yeah. I mean, that's a great answer. I mean, also the discussing is going becoming more interesting. Another question that I'd like to ask you is that I mean, for general practitioners and for MD physicians, it is quite reasonable and also quite, it is possible for them to see or, I mean, telemedicine is quite easy for them. It comes handy because they don't have to always do any operative procedure. But for dentist, they always have to, I mean, do any kind of surgery or any procedure as such. So how do you think, I mean, teledentistry would be as feasible as a telemedicine practice?
Yeah, I mean, if you look at things like oral medicine, oral pathology, to an extent, community dentistry, and definitely doing the first consultation, I think those can be done online. I think we should not completely dismiss the telemedicine platforms, saying that yes, dental surgery is a lot about procedures. I have to make the patient sit on the chair. I have to use the drill. I have to use the scaler. I have to use the restorative equipment. So I have to do a root canal. So I have to actually physically interact with the patient. So tele dentistry can't work. I think it can. It can to a great extent in simple things like diagnosing the source of pain, right? What kind of pain it is. If you lie down, does the pain increase? So that'll give you a difference between whether it's a gum pain or a pain due to a cavities or abscess. So things like that. I think basic diagnosis, the first consultation, breaking that first barrier, making that patient comfortable that yes, I could be that trusted dental services provider that you've been seeking. I think that can be done on telemedicine. But I take your point, about 60 to 70% of our services would require physical interaction, and that would require the patient to visit the doctor and not the other way around. But at the same time, there is a lot of possibility and a lot of innovation that can be brought in the way we use the telemedicine platform available to us to enhance our practice. And I think that's an opportunity that dentists should not let go. Dentists should not say, hey, this is for the medicine guys, I need to interact. There's an opportunity. You have to figure out the cases, the patients, the kind of people you want to deal with. Also, it can be very useful in case of senior citizens if you want to make a call whether the patient has to come or not, and if the patient has any restrictions on movement, maybe an initial consultation over telemedicine might be a good idea, following it up with the procedure at the clinic. So there are options, Paritosh. It's just how creative do we get around the situations and the opportunities that lie in front of us.
Right. Thank you so much for answering these questions. I think it was really nice discussing, and all the questions are very well handled by you.